If you spend any amount of time in the fertility community, I mean, scrolling through forums at 2 in the morning or just sitting in those waiting rooms, you hear the same things again and again.
Oh, yeah. It's a numbers game.
It's a numbers game. Just keep rolling the dice.
Right.
And it's this idea that, if you just put up with enough heartbreak and spend enough money, eventually your number has to come up.
And it's comforting in a way. I get it. It sort of implies it's inevitable, but it's also so frustrating because if you're the one at the table, you don't just want to rely on luck.
No.
You want to know if the table is tilted. And, more importantly, if there's a legal way to tilt it back in your favor.
Exactly. You want to stack the deck. And that is literally the phrase we're anchoring this whole deep dive on today. We're looking at a source stack that really challenges that binary mindset of Western science versus ancient tradition.
Mm-hmm.
We're looking at data, and I mean hard data, not just stories, that suggests the real cheat code, for fertility might actually be integrating the two. Specifically, combining things like IVF with traditional Chinese medicine.
Right.
And, just to set the stage here, because I know traditional Chinese medicine, or TCM, it can sound a bit abstract maybe to a skeptical listener.
Sure.
We aren't talking about vague wellness concepts today. The sources we have, they come largely from the Berkeley Center and the work of Mike Berkeley, and they are packed with clinical observations, systematic reviews, and meta-analyses. We are talking hemodynamics, relative risk ratios, p-values.
Which is exactly why I wanted to get into this. I think a lot of people just assume that if you go the, quote, natural route, you're somehow rejecting your doctor's science.
Right.
But the whole mission here is to unpack how adding acupuncture and herbal medicine to a Western regimen can actually make the Western science work better. For egg quality, sperm DNA, all of it.
It's not an either-or thing. The source material is so explicit about this. It's all about adding layers of support.
Layers. I like that. Think of it this way. Western medicine is incredible at forcing a biological event. They can make ovaries produce 20 eggs instead of 1. They can trigger ovulation at a specific hour.
They are masters of the what?
Exactly.
Yeah.
They're masters of the what, but maybe not always the how well.
Ah, that's the gap.
That's the gap. Western medicine forces the event, but TCM addresses the terrain, the environment where that event happens.
Mm-hmm.
There's this great gardening analogy in the research.
Yeah.
Western meds are like the high-quality seeds and the really potent fertilizer you push into the ground. But TCM, that's the soil quality. It's the irrigation, the sunlight.
So if the soil is bad, it doesn't matter how good the seed is.
Exactly. It doesn't matter how expensive or advanced that seed is.
Yeah.
It's going to struggle. You can't force a prize-winning rose to bloom in concrete.
That makes perfect sense. Okay, so let's get into the engineering of this soil. We've got 2 main tools here, acupuncture and herbal medicine. Let's start with the needles, the outside-in approach.
Outside in is a great way to put it.
Mm-hmm. Now, I've had acupuncture for back pain, and they talk about moving qi or energy. But for someone looking at this from a purely physiological lens, how does a needle in my leg help my ovaries? I mean, is there a mechanism that isn't just magic?
Absolutely. And the sources give us a really robust physiological translation. It's not about energy, really. It's about hemodynamics.
Hemodynamics, that sounds like engineering.
It basically is. It's fluid dynamics for the body. When an acupuncturist puts a needle into a specific point, it's not random. It triggers a very specific reaction in the nervous system.
Okay.
And that reaction causes vasodilation, the widening of blood vessels. But the key here is that it's targeted. We're not just lowering your overall blood pressure. We are ramping up blood flow specifically to the reproductive organs, ovaries, uterus, testes.
So you're opening up the clogged highways so traffic can actually get where it needs to go?
Precisely. And what's in that traffic? Blood is the delivery system. It's carrying oxygen, electrolytes, nutrients, and those crucial hormones. If you're taking Fulistim or Gonal F, those drugs are useless if they just stay in your bloodstream. They have to get to the follicle. Acupuncture makes sure the delivery trucks can actually reach the construction site.
So if you have, say, a cold uterus or restricted blood flow from stress or inflammation, you're basically starving your ovaries of the medicine you're paying thousands of dollars for.
That is the implication, yes. And the payoff is measurable. For women, the sources talk about healthier eggs and a uterine lining that's thicker and trilayer. That's the gold standard for implantation.
Right.
But and this is where the research gets really interesting. It's not just about the women.
Yes. The male factor. I feel like 90% of the time, the guy is treated like an accessory. He provides a sample and then goes back to the waiting room.
It's a huge oversight. Male factor is involved in, 40 to 50% of infertility cases?
Yeah.
The data here is very clear. Acupuncture works on testicular blood flow just as well as it does on ovarian flow.
And what are we fixing there? Is it just about sperm count?
Count is the basic metric, sure. But the sources focus on quality. We're talking about motility, how they swim, and morphology, their shape. But the heavy hitter here is DNA fragmentation.
I've been seeing that term pop up more and more. It sounds bad.
It's a major hidden cause of unexplained infertility and recurrent miscarriage. You can have a guy with a totally normal sperm count, so the basic analysis looks fine.
Okay.
But inside the head of that sperm, the genetic cargo is damaged. The DNA strands are literally broken.
So the package gets delivered, but the instructions inside are all shredded.
Exactly. The egg might fertilize, but the embryo can't develop properly. It just arrests, or it leads to an early miscarriage. Acupuncture helps reduce the oxidative stress that causes those breaks. It's quality control at the factory.
Okay, so that's outside in. Fixing the plumbing. Now let's pivot to the inside-out approach. Herbal medicine. This is where I think people get a bit more nervous.
It's a valid hesitation. Needles are one thing, but ingesting things.
Right.
But the distinction the source makes is vital. Acupuncture is about flow and immediate response. Herbal medicine is about internal chemistry, building resources. You take these custom formulas orally, and they influence your hormones, they ease inflammation, they correct these deeper imbalances.
So if acupuncture is the delivery truck, are the herbs the actual cargo?
That is the perfect analogy.
Yeah.
Yes. The herbs provide the nourishment. The sources say they're particularly good for addressing root causes, like, for example, endometriosis.
Which is so common and painful.
And it's fundamentally an inflammatory condition.
Yeah.
It creates this hostile environment where the immune system is hyperreactive. It can attack sperm or an embryo.
Yeah.
Certain herbs are designed specifically to cool that inflammation down. It's like calling off the attack dog so pregnancy can happen.
The sources also mention aging eggs. Now, I have to push back a little here. I mean, Biology 101 says you're born with all the eggs you'll ever have. You can't unage an egg, right?
Not chronologically, no. You can't change the date on it.
Yeah.
But, and this is a huge but, you can change the environment in which that egg matures. An egg goes through a recruitment and maturation phase that takes about 90 days before you ovulate it.
The recruit class.
Right. And during that 90-day window, that egg is so influenced by your body's chemistry. If you use herbs to optimize that chemistry, flood the system with antioxidants, balance hormones, the egg that's released at the end is going to be of a much higher functional quality.
So you're optimizing the final manufacturing stage. Okay, that makes sense. And I assume the whole stacking the deck idea means doing both.
Synergy is the key. Acupuncture for the immediate, targeted circulatory boost, herbs for the long-term, systemic equilibrium. When you put them together, you're hitting the problem from both sides.
Okay, I'm following the logic. The engineering holds up. But I'm a cynic at heart, and I know our listeners are too. We need to see the receipts. Theories about flow and soil are great, but do they actually lead to babies? What does the data say?
I love that you asked that because this is where the deep dive gets surprising. The source material is remarkably robust. Let's start with the acupuncture numbers. There was a 2019 systematic review and meta-analysis that is just. It's a crucial piece of evidence.
And a meta-analysis, for everyone at home, that's the top of the food chain for evidence, right? It's a study of studies.
Correct. They pooled data from 27 studies, over 6,000 participants. It's a massive sample size. And they found that acupuncture significantly increased clinical pregnancy rates. The relative risk was 1.21.
Okay, translate that for me.
It means there's a statistically significant benefit. You are more likely to get pregnant with it than without it. But here's the aha moment from the data. The benefit was greater for women who had prior unsuccessful IVF cycles.
Wait, really? So if you've already tried and failed, which usually means you're a difficult case, acupuncture helps you more?
According to this review, yes. The relative risk for clinical pregnancy jumped to 1.60 for that group. It's a massive difference. And the live birth rate, RR, was 1.42.
That feels so counterintuitive. Usually treatments work best on the easiest cases.
The thinking is that those failed cases are often failing because of the very things Western medicine can overlook: uterine receptivity, subtle blood flow problems, high stress. Acupuncture addresses those missing layers and solves the specific problem that was causing the failure. It's basically a rescue protocol.
That is so validating for anyone who's had a failed cycle. It's not just try again, it's trying differently.
Exactly. And the CAM therapy summary meta-analysis found acupuncture increased IVF live birth rates by 33.8%. It moved the success rate from about 28% to 38%.
That's a 10 percentage point jump. In the fertility world, where you fight for every single percent, that is enormous.
It is. And for the toughest cases, patients with repeated implantation failure. A 2024 study showed acupuncture improved live birth rates to 54.5% versus just 41% in the control group.
So you're crossing the threshold from a coin flip to, well, a weighted coin flip in your favor. But getting pregnant is one thing, staying pregnant is another.
The sources cover this too. They cite a finding that acupuncture reduced miscarriage rates by 43% in some trials compared to no treatment.
A 43% reduction.
Yes. And there's an ongoing trial right now that's specifically looking at acupuncture's role in euploid embryo transfers.
Those are the genetically tested perfect embryos, right?
Correct. And if a euploid embryo miscarries, it's almost certainly a uterine environment issue. This trial is trying to prove that the soil matters just as much as the seed.
Okay, acupuncture passes the data test. What about the herbs? Because I feel like Western medicine is so skeptical of mixing herbs with drugs. Is there real data on that?
There is. And honestly, the numbers here are even more aggressive. There's a concept in the source material called the twofold jump.
Ooh, I like the sound of that.
It comes from a 2011 systematic review. They looked at Chinese herbal medicine, or CHM. They found that CHM improved pregnancy rates twofold within 4 months compared to Western drug therapy alone.
Twofold. So, double.
Double. The numbers were 60% success for the herbal group versus 32% for the drug therapy group. Even compared to just IVF, which sat around 30%, the herbal approach showed 50%.
Okay, I have to pause here. If there is a treatment that literally doubles the efficacy, why isn't this headline news? Why isn't every clinic doing this?
Well, it challenges the paradigm. It's hard to patent an herb, and it requires a level of customization that doesn't fit neatly into the Western model. But the data keeps backing it up. Look at PCOS.
Notoriously difficult.
Right. A 2021 review showed Chinese herbal medicine improved clinical pregnancy rates with an odds ratio of 2.41 for women with PCOS going through IVF.
So again, more than double the odds.
Yes, and for miscarriages, one study showed a reduction in miscarriage rates from 23% in the control group down to about 12 or 13% in the herbal group.
It cuts the risk almost in half. That really connects back to what you said about herbs building resilience and fixing the root cause.
Exactly.
Okay, I am sold on the numbers. But I have to play devil's advocate. I'm putting myself in the shoes of someone listening who's maybe prepping for an IVF cycle right now.
Mm-hmm.
Their doctor has them on a strict schedule. They have a sharps container on their counter. The idea of taking herbs sounds scary. Is it safe? Will it mess things up?
This is the most crucial question, and the sources address this fear directly. The safety profile relies entirely on one thing: customization.
So, not just buying fertility tea off the internet.
Absolutely not. Please do not do that.
Mm-hmm.
The sources emphasize that safety comes from formulas being tailored to your body's patterns by a certified professional. We mentioned Mike Berkeley earlier. He is unique because he's board certified in both acupuncture and herbal medicine.
And why does that dual certification matter?
Because he understands the pharmacokinetics of the Western drugs. He knows what your liver is processing. A certified herbalist can look at your medical history and your current medication protocol, Lupron, Menopur, whatever, and create a blend that supports it, rather than fighting it.
That makes so much sense. It's the difference between buying a suit off the rack and getting one tailored.
Right. And when it's done that way, side effects are uncommon and minor. We're talking short-lived digestive changes, which you could fix just by tweaking the blend.
Compare that to the side effects of fertility drugs, which can be brutal.
Well, the source draws a really stark comparison here. It references a 2025 context on adverse drug reactions from Western medicine.
Oh, is this the hospital admission stat?
Yes. Adverse drug reactions are linked to up to 30% of hospital admissions in older adults. Now, obviously, that's a different demographic, but it just illustrates the burden of pharmaceutical side effects.
And the herbs.
In contrast, hospitalizations from traditional Chinese herbal medicine are described as exceedingly rare globally. In the U.S., there are just no widespread reports of severe adverse effects leading to inpatient care when it's administered by a professional.
That is a really reassuring perspective. You know, we think of standard medicine as safe and alternative as risky, but that data kind of flips the script.
It really does.
Yeah.
It just reinforces why you need a guide who understands both worlds.
So let's bring this all home. What does this mean for someone listening who's in the thick of trying to conceive or maybe just starting to think about it?
I think the big takeaway here is that we need to stop thinking in binary terms, natural versus medical. Integrating these modalities addresses the things Western medicine sometimes glosses over. It tackles ovulation, sperm health, uterine lining. It addresses the soil so the seed can grow.
And the sources say this makes the path to parenthood easier and quicker. And honestly, in this world, quicker is the magic word.
It is. Time is the one thing you can't buy more of. But the call to action here is personalization. This isn't a magic pill. It's a plan bit for your specific physiology.
So you need someone who can read the blood work and read the pulse.
Exactly.
You know, I just can't stop thinking about that twofold statistic. It's been rattling around in my brain this whole time.
This is one that sticks with you.
It really is. And I want to leave you with this thought. We spend so much time and money and emotion on the high-tech side of fertility, the lasers, incubators, genetic testing. But if a natural, low-risk intervention can potentially double your success rates, does that suggest that the future of fertility treatment must be integrative to be truly effective? Maybe the missing piece of the puzzle isn't a new drug, but an old wisdom.
A powerful thought to end on.
Thanks for diving in with us. We'll see you next time.